Here from Kirribilli because, like others in Sydney, this is where I was. We're in lockdown, and I intend to be able to relocate to Canberra, myself that is, next week in preparation for the parliamentary sittings that will take place in August. Earlier today, the National Security Committee of Cabinet met to consider a range of issues in the ongoing management of the COVID-19 Delta outbreaks, and that was also to consider the more recent information that we've seen emerge in Victoria. I've had discussions with the Victorian Premier later today after that meeting, but was briefed on that situation by the Chief Medical Officer, along with the other members of the National Security Committee and those co-opted to consider potential arrangements should there be any changes in Victoria. But we also made a number of changes that relate to a situation here in New South Wales with the ongoing lockdown here. The first of those was that we will be restoring the temporary Medicare telehealth system, and that means there will be a new MBS, new Medicare item reintroduced to ensure people in COVID-19 hotspots, that is entire Greater Sydney area, have access to longer phone consultations, that's 20 minutes or over, for chronic conditions or other health issues that may require doctors to spend more time with patients. That's an effective measure that we've had in place previously, and the Health Minister, Greg Hunt, recommended that we bring that forward again, and that is being done. That takes place pretty much immediately. Secondly, you would have seen reported today from our statement that the childcare gap fee waiver will be put in place. That's from the 19th of July. There are some 3,634 childcare services that can be assisted through this, and some 216,000 families in the areas that are impacted. Now, what this basically means is that if your child doesn't go to childcare in these lockdown areas, it means that you won't be charged a gap fee. And the centre will continue to receive support, so that supports the centre. Your place with your child is maintained through that arrangement. We have successfully implemented and put in place these arrangements in past lockdowns, and they've proved to be very helpful for families and the childcare sector as well. Also, while we're still on New South Wales, can I note that from today, if you are in Bayside, the City of Sydney, Canada Bay, Inner West, Randwick, Waverley and Wallara, from today you can go to my.gov.au, and you can make your application for that higher payment, the one that I announced with the Premier earlier this week, the $600 and $375 payment. You can make that application on my.gov.au. Can I encourage you to preferably go to the website? It's quicker, and it means that the processing is quicker. If you need support on a phone line, you can call the 180-2266 line, but particularly those calls are there to support those who may have language difficulties or particular circumstances that need further discussion or things of that nature, or people are looking for further explanations. That phone line is there to provide further assistance, but if it's very straightforward, can I encourage you to go to the my.gov.au website? That will help everyone at Services Australia to turn these things around as quickly as possible. From Sunday, you can apply across Greater Sydney and across New South Wales for those payments where you've lost more than 20 hours or 8 to 20 hours, as we've already announced. Can I also note today the vaccination numbers